Assalamu alaikum. I think we'll go ahead and get started. Um, I have never done a webinar before, but I did get lessons, so hopefully this will go smoothly. Um, First of all, I'm Mariam Mahmoodian. I'm a family physician here in Harrisonburg. And I think this is a really important topic to discuss. Ramadan is coming up. It's a little bit later than I planned to give this, but I think it's still really relevant. Um, I think it's a very relevant topic, actually, because unfortunately, diabetes has increased quite a bit in the US and the world. And so I just think it's really important to address this topic, especially before everybody starts fasting, which will be coming up here pretty soon. So that's why I decided to give this talk today. And so we'll just go ahead and get started. Let me see. So the first question is, for somebody with diabetes, should I fast or not? And then you have to look at the Quran and see exactly what it says. And this was taken from Surah Al-Baqarah, Ayah 185. And the key things that I want to take away from this are the second part, which is whoever is ill or on a journey, then an equal number of days, implying that an equal number of days should be fasted. And then the last part of the ayah is that Allah intends for you ease and does not intend for you hardship. And I think that's one of the most important things to remember, because Allah does not want us to have a hard time. And so if we can't fast, then because we're ill, because of a chronic disease like diabetes, um, then it's important to know that. So just to start, these are just a couple of studies that have been done. And a lot of studies have been done in majority Muslim countries, and some not. And I used to work at a community health center in Lincoln, Nebraska. And in the city where I was, there was an endocrinologist who was not Muslim, but he was from Syria. So he was very familiar with Ramadan. And so when I first did a similar presentation, he's the one who helped me and showed me some of these studies. So that's where I got these from. So a lot of studies have shown that diabetics who fast during Ramadan have an increased risk of complications. And some of these complications included things, such things as having severe enough low blood sugars to require hospitalization, or severe enough high blood sugars to require hospitalization. Um, they also noticed that there was an increased risk of dehydration, and as a result, some complications or side effects, I guess, from having dehydration are that it can drop your blood pressure, it can make you feel dizzy, and of course, if you feel dizzy, you're more likely to feel off balance, and as a consequence, more likely to fall. And if you fall, then you can sprain your ankle or wrist, or even potentially, get a fracture or break a bone. Um, and then one large study that was done, um, which had 12,000, around 12,000 Muslims. And this study was done in 13 different countries, some majority Muslims, some not. And what this showed um, was that type 1 diabetics, and that is type 1 is that usually it's juvenile onset, um, but not always. But type 1 diabetics who are always dependent on insulin, um, who fasted during Ramadan, had a 14% chance of developing severe low blood sugar. Type 2 diabetics who fasted had a 3% chance. And that number doesn't really seem like it is very high, 3%. But when you think about who ended up having to go to the hospital because their blood sugar was too low, that was 14 out of 100 type 1 diabetics. So it is a little bit high, or 3 out of 100 type 2 diabetics, which again is a little bit high, especially considering that um, type 2 diabetics are at a much lower risk um, when they're not fasting of having a low blood sugar. And, especially at this time, you really don't want to have to go to the hospital, or, unless you absolutely have to, just because of COVID-19 and possibly being exposed, and not to mention being exposed to the flu, or everything else that's out there. So that is why it's again important to know your limitations, and when you should not fast. So this is just a list of individuals who should not fast, individuals who have diabetes who should not fast. And again, this is something that I had discussed with the endocrinologist. So type 1 diabetics as a whole should not fast, because all type 1 diabetics are insulin dependent, and it's just a little bit more difficult to control when you're fasting. Another group who should not fast is any diabetics who have had at least one episode of severely low blood sugar in the last 3 months. So in the 3 months before Ramadan. Um, Another group is diabetics who have had frequent problems with low blood sugars. So, low blood sugars that occur a couple times a month or, a couple times a week. Um, you're just at a higher risk for having further problems with low blood sugars when you're fasting. Um, Another group would be diabetics who can't tell when their blood sugar is too low. And this goes back to, again, diabetics with frequent problems with low blood sugars. If they occur frequently enough, then you may get to the point where you can't even tell that your blood sugar is too low. And if that's the case, then you should not fast because you're just at a high risk for having low blood sugars if you are. Women who are pregnant during Ramadan, women who have diabetes or gestational diabetes are at a much higher risk of developing complications during pregnancies. And one of those is early labor. Um, and um, because women who are pregnant um, in general have a high likelihood of getting um, dehydrated if they're not drinking enough fluid. And so, of course, if you're fasting during the day, you're, of course, not drinking fluid. And so you're at an even higher risk of getting dehydrated, which can lead to, preterm labor. And another group is diabetics with kidney disease, and this would include, of course, diabetics on dialysis. And this is another group of individuals who are at a higher risk for becoming dehydrated. And so that's another group who should not fast. Um, um, can you hear me? Okay. Um, I am just going to go ahead and get started. I have never done a webinar before, so I hope this goes smoothly. I did get some lessons, so we'll try. And if you can't hear me, just be sure and let me know. So first of all, Assalamu alaikum. And I'm Maryam Mahmoodian. I'm a family physician here in Harrisonburg. And the first time I gave this presentation, or a similar presentation, was actually live. And that was when I worked at a community health center in a different state. And I was fortunate in that state that there was an endocrinologist there who was not Muslim, but he was from Syria. And so he was very familiar with Ramadan and the fasting. And so he originally helped me put this together. So I just think this is a really important topic because, unfortunately, diabetes is on the rise worldwide and, of course, in the US. And so along with that, there's, of course, a large number of Muslims who are also diabetic. And with Ramadan coming up, it's just important to know or feel comfortable knowing whether or not you should be fasting. So the first question you should ask is, I have diabetes, so should I fast or not? And then, of course, as Muslims, we look to the Quran. And so this ayah was taken out of Surah Al-Baqarah, and it's ayah 185. And this, really tells us whether or not we should be fasting. And the main part of this ayah that I want to point out is that Allah intends for you ease and does not intend for you to have hardship. And, so this is really important to remember for anybody with a chronic disease, diabetes or any other one. And just to start with some studies, and to break a couple of these down, there have been quite a few studies that have been done, mostly in Muslim majority countries. And overall, these have shown a higher risk for complications in diabetics who fast. And some of these complications have include having severe enough low or high blood sugars to require hospitalization. And I think this is really important, especially at this time, because of COVID-19 and the risks out there, and especially, more so if you're in the emergency room. You're at a higher risk, just in general, of having a low blood sugar, or developing, whatever is out there in the emergency room, whether it's the flu or any kind of viral or bacterial illness. So you don't want to have low blood sugars. or high. And then another complication is having is that you're at an increased risk of developing dehydration, and anybody who's dehydrated has a higher risk of having a low blood pressure, which can make you feel dizzy and then increases your risk of falling and all the complications that can happen when you do fall, whether it's spraining something or, potentially even breaking a bone. Um, so, um, and then the last study that I want to point out was a pretty big one. Um, and it included over 12,000 Muslims, and these were in both Muslim majority and other countries. And these showed, again, that type 1 diabetics who fasted had a 14% chance of developing severe low blood sugars, and type 2 diabetics had a 3% chance. And this may not seem like it's very high, but if you look at, in other words, this was 14 out of 100 type 1 diabetics, or 3 out of 100 type 2 diabetics. And 3 out of 100 may not seem very high, but just to keep in mind that type 2 diabetics who are managed either by diet or on oral medications are at a pretty low risk of having low blood sugars. And so this is higher than normal. And so it's just important to keep that in mind, especially during Ramadan, if you do choose to fast. So the next thing I just want to point out is who should not fast. And this is just a general list. Again, this is a list not just that I am making up. It came again from an endocrinologist who I'd worked with. So as a whole, type 1 diabetics should not fast. And this is because type 1 diabetics are insulin dependent and at just a higher risk for developing low blood sugars and complications. Another group is diabetics who have had at least one episode of severely low blood sugar in the 3 months before Ramadan. Another group is diabetics who have frequent problems with low blood sugars, whether it's a couple of times a month or, a couple of times a week. And then diabetics who cannot tell when their blood sugar is too low. And this goes back to having frequent problems with low blood sugars, because if those occur frequently, then at some point you might end up to the point where you just can't tell that your blood sugar is too low. Pregnant women as a whole should not fast, pregnant diabetic women should not fast, whether you're diabetic or just have gestational diabetes. And this is just because it increases your risk of dehydration, which increases your risk of going into preterm labor. And so as a whole, diabetic women or just women who have gestational diabetes should not fast. And then diabetics with kidney problems, including those on dialysis or not, should not fast because this again goes back to the increased risk of developing dehydration, and um, so just in general, these individuals should not fast. Um, Another group is diabetics who perform very intense physical jobs, because again, that goes back to the increased risk of low blood sugars or dehydration. And especially if you're working outside, on and really that just puts you at a higher risk. And the same goes along with diabetics who have any complications, whether it's eye problems like retinopathy, or again, kidney disease, or even neuropathy, the numbness and tingling sensations. And the reason for that is these individuals are, again, at a higher risk for having low blood sugars. And another group is diabetics who live alone. And this is another important group, because if you do live alone and your blood sugar should drop, then there's really nobody around you who can help. So it's just important, if you have family around, or it's an important time to be around people if you are going to fast. And then elderly diabetics also as a whole should not fast because of the same reasons, just an increased risk of either low blood sugars or dehydration. So some important recommendations to keep in mind is, one is to educate your medical provider about the requirements that go along with fasting during Ramadan, because most medical provider, or at least primary care providers here, are not Muslim, and so they may be familiar with Ramadan, but they may not be familiar with all of the requirements. They may know that Muslims fast during Ramadan, but may think it's different, that we fast, we eat breakfast, for example, and then fast the rest of the day until dinner, just different things like that. And so it is important to talk to them and explain a little bit, or make sure they understand what's involved. And another recommendation is to be honest with your medical provider about your blood sugars, and don't try to sugarcoat them because you're worried that they might tell you not to fast, because believe it or not, we are smarter than I think we're given credit for. And so we will be able to tell, if your blood sugar, if your blood sugar, if you try to tell us, for example, that your blood sugar is always around 150, but your hemoglobin A1C, for example, is 6%, then we're gonna know that it's usually lower than that. Or if your hemoglobin A1C is 10%, we're going to know that on a whole, it's not 150. So, so it's important to just be honest. And it's also important to listen to your provider if they tell you not to fast, because we do want what's best for you. We don't want any complications to happen, and so it's just important to listen to them, or to us, I guess. Um, and if you do fast, some recommendations are to frequently check your blood sugar. Um, if you only check it once a day, or if you only check it 3 times a week, it's important to check it more than that when you're fasting, at least a couple times a day. It's important to eat a healthy and well-balanced diet, which you should be doing anyway, but more so at this time, especially having a healthy suhoor and a healthy iftar. It's also important to try not to lose weight during this time. We worry about gaining, or I'm sorry, we think that this is a good time to try to lose weight, but it really isn't. It's important to try to either maintain your weight, or even if you gain a pound or two, that's better than trying to lose weight. And during sahur and iftar, it's important to make sure you are drinking enough fluids. And you don't want to eat a lot of, and I'm sorry, I should have said simple carbohydrates like sweets, which you should not be doing anyway. And a lot of high fat foods. And then it is a good idea to eat foods that have complex carbohydrates, especially during suhoor, because these are more filling, and these are things like whole grains, whole wheat, um, things like that. So whole wheat bread, um, and anything that has complex carbohydrates. I'm sorry, I'm just drawing a blank right now. Some other recommendations are to eat sahur as late as possible. Sometimes we, as a whole, Muslims, we will stay up very late and then eat sahur around midnight or 1 in the morning, and then just go back to sleep, and um, then we can sleep a little bit later, and we don't have to worry about waking up so early. But for diabetics, it really is better to eat as late as possible. It's important to continue your regular activities, but not to overdo it. So, do whatever you normally do, but again, and this goes back to not trying to lose weight, you don't want to start an exercise program now if you don't usually exercise, or it's not a good time to start walking 5 or 6 miles a day if you just don't do that as a whole. So that's important. You, of course, do not want to fast when you're sick. If you do get sick, and this actually pertains to anybody, whether we're diabetic or not. And it's also important to make sure you're wearing a medical alert bracelet, which you should be doing anyway. just in case something were to happen. Some requirements if you do fast are to just never adjust your medication without first talking to your provider. You know, you may have been diabetic for years, but you still need to talk to your provider if you're going to before you make any kind of adjustments. And then make sure that you always have something sweet, just in case your blood sugar should drop, so or should go down, and you become symptomatic and you need to break your fast. It's just important to always carry something sweet with you, whether it's a glucose tablet or you know, just a piece of candy. That is just something you should do. And these are absolute requirements if you do choose to fast. And there's just no arguing about this. They're just absolute. You want to always and immediately stop fasting if your blood sugar is under 60, because there's a very high chance, and actually a very, very high chance that it will just continue to drop. And so if it's under 60, if you're first of all, if you're symptomatic and you check it and it's under 60, or you're just doing a random check and it happens to be under 60, then you need to break your fast. And the same goes for if it gets high, if it gets over 300. Even if that is normal for you, which I hope it is not, but then you need to stop fasting. And again, you need to stop if within a few hours after suhoor your blood sugar is under 70, because if that happens 3 or 4 hours after you eat, then it's very likely that it's going to continue to drop. So, so you want to stop fasting at that point before it gets too low. And then these are just some suggestions to talk to your medical provider about. But it's important not to make any of these, do any of these without talking to your provider, because, you know, I may be a family physician, but if I'm not your physician and I don't know you and know how your diabetes is controlled, then you need to talk to your provider if you have questions like these. So if you're a diabetic who's diet controlled, one thing you might want to ask is if it's a good idea to do 2 or 3 small meals during suhoor and iftar instead of having one big meal. You know, just to ask them if they think that would be a better idea. And then if you take oral medication only, then you should ask your provider if you should continue taking the same medications or taking them the same way or change the times. You know, and one example of this would be a group of medicines called the sulfonylureas, which are medications like glipizide, glyburide, glimepiride. Those have increase your risk of having a low blood sugar. And so it your provider may want you to take a lower dose, or may want you just to take it at one time of the day, like with iftar instead of twice. So it's a good idea to ask them that question. And, I should have said, Ramadan is coming up here in a few days. So you may not have time to actually see your provider, but most providers and offices have uh, provider patient portals. And so that's an easier way to communicate than actually to try to do so by phone. Um, so anyway, so these are questions you can ask through the portals. And some other things are, if you use insulin, you want to ask them if you should make any changes in the amount that you take or the timing, because they may want you to lower the amount of, whether it's a long acting like Lantus or Levemir, or short acting like Humalog, or regular, I guess Humalog, or Novolog, because it's the fast acting mainly that increase your risk of having a low blood sugar if you don't eat enough. So that's a good question to ask your provider. And if you have high blood pressure also, you want to ask them if you should take a lower dose of your medication, so your blood sugar, or I'm sorry, so your blood pressure doesn't get too low, because then that puts you at a higher risk for feeling dizzy and, potentially falling. And depending on the medication that you take, it could increase your risk for getting dehydrated if you're on a diuretic like furosemide or Lasix, or hydrochlorothiazide, diazide, and medicine like that. And another thing that's really important is to never ever think that you're weak because you can't fast. And this just goes for anybody as a whole with any kind of chronic disease, whether it's diabetes or high blood pressure or just anything. You should never think that you're weak because you can't fast. And, going along with that, you should never think that you're weak because you have to break your fast because your blood sugar goes down or blood pressure, goes too high. It's just important not to feel that way, not to feel like you're weaker than everybody else because you have to stop your fast or because you can't fast. Because a lot of us do. A lot of us who have chronic diseases, we just feel bad. We just feel like we're not good enough as everybody else. So it's just important not to feel that way. And then that goes back to the ayah that I mentioned at the very beginning. And again, that Allah does not intend for us to have hardship. And so if we really cannot fast, then we should not fast, because otherwise we're going to develop complications. As diabetics, you're going to develop complications, and that is not that's not what Ramadan is about. There's other things we can do to make up for that, whether it's fasting during the winter when the days are shorter, or you know, um, I'm sorry, feeding somebody, donating money to for a meal for somebody. Um, just there's other things that you can do other than fasting. So, um, and so that's all that I have. Um, again, this is the first time I've done a webinar, so I'm not sure if I know how to take questions. Um, uh, but anyway, I'll let me see if I can figure this out. Um, no, that's not what I wanted to do. Okay, there we go. Let me see how to get up there. Um, oh no, wait a minute. Okay, there we go. So let me see. If anybody had any questions, if anybody has any questions, they can type them and I'll try to answer them. I'm not qualified to answer questions specifically about medications that you might be taking unless uh, you happen to be my patient. But if you have questions about anything else, I'll try to answer them. And if not, then that's all I have. So I hope this helped as a whole, just to understand more about when you should not fast, when you should, complications that can happen if you're diabetic. Um, and so, anyway, so that's all I have. And if nobody has any questions, then we'll just end it at that. So thank you. And I hope this was helpful. And I hope it went well. And if you think of any questions, I didn't put my contact information, but Zainab has it. So, so anyway, so that's all I have. Thank you again.